My people, Dr. Nature don't learn today with very interesting topic. You know, so as adults, they meet people, they meet man, woman. Most of the time, they will come fall in love, fall in love, and from that process, we feel they intimate and get sexually transmitted disease in the process. Not be say we now wait till we want, but if it happen. Now you make a carry the matter, come my channel, Think Health with Dr. Nature. And for today, you know, we dey talk about different health issues. And if you just join my channel, I welcome you. And if you don't watch on my channels before, come they watch, they follow, they subscribe. I hail una. Remember, say this video, if it use them do sex talk and it affect everybody. I no be pastor, I no be judge. I just dey here to talk as it take be. And what we come go yarn today now, sexually transmitted infections or sexually transmitted diseases, STDs, STIs. So we go know what it can be sexually transmitted infections. These are infections or germs where they pass from one person to another person through sexual contact. So now the main thing, I don't talk about the one where they pass through cough and the rest. Now through sexually transmitted disease, through sexual contact. If it be vaginal intercourse or oral sex or anal sex or even touching body, just skin to skin touch. So what it come to the fact, so we supposed to know about the sexually transmitted disease. You know, say more than 1 million people they catch sexually transmitted disease every day worldwide. And majority of them don't even know so they get them. They just go, they spread, they collect, and they get more than 20 different types of sexually transmitted diseases. Now here, more than 20. Some of them will be bacteria, some are viruses, some can be parasites. Parasites. They tiny. We can't do for ourselves. We can't share and they give people. They collect. They go. Don't be saying our fault. You know, somebody go jolly. As you don't know, reach this part. What you come with the risk factor? What you go make Mr. A go come catch him or Mr. B or Madam B? Number one, females. You know, say females are the ones where they receive. Most times they are receivers. So they are at risk of collecting or having sexually transmitted disease. Unprotected sex. Some people say, I don't want to use condom. I want direct and everything. Now risk factors for sexually transmitted. Or you can't they share, they give. They share as Nathaniel. Can't they collect as Nathaniel? Keziah, they share. Multiple sexual partners now risk factors for transmitted. Some people say, I only get one partner, but that partner fits the more promiscuous. And if you don't get STI before, now risk. Or sexual harassment for females or children who don't they harass because they take them by force, they have more likelihood, more wound, more problems of getting sexually transmitted diseases. Then alcohol abuse, where those who go to drink, so they don't know where they can do. People where you fit refuse, say you know one do, you can't they do with them because alcohol don't carry the brain for that time. Or even drugs, those who they use sexually enhancing drugs or drugs to enhance sex, it can also be a risk factor for STIs. The other one, now new partner. Yes, when you have a new partner or when you come jam person for the first time, never know the person. You don't know which the one the person gets, and you don't even know the sexual history. How many people don't meet before? So having a new partner can also be a risk factor for STI. Then the last one, but not the least. Now, if you date between the ages of 15 to 24, yes, you don't mature, you don't get phallus, penis, or you don't get breasts and everything, but you never mature well. Especially in females, because the body system, the cervix never mature well. If they're more at risk of getting sexually transmitted diseases. So the symptoms or waiting go show for body, where person will come know say, I feel get STI, differ from one person to another and depend on the type of STI. If person get gonorrhea, no be the same thing with person will get syphilis. Or if person get HIV, no be the same symptom in go show. I no go fit explain everything for this video, but for the next video I go explain that. But another time when you go come day for your head, we say STI, sexually transmitted infections, no be toilet infection. People they say, I get toilet infection, but they, for their mind now STI they call on it. They for their head now sexually transmitted disease they carry for mind. No be the same thing. You know, so I don't get video for toilet infection. If you watch them, Sabiam, the ejaculation must not occur. Everybody say, but I no release now. I no release. It's right for the men. No, even touching body, you can spread STI. Kissing, other things, you must not ejaculate for for sexually transmitted infection to occur. Erase that one from our mind. You know, follow. So what are the STIs? What come be these infections? I want me to write the one way una sabi. Put up for the comment section. For this video, I don't classify them as bacteria like gonorrhea, syphilis, chlamydia, and chancroid. Some of them you never hear them before. I know so gonorrhea I don't hear them for pack. Then you can't get viruses like HIV and AIDS. That one they very common when they know that one. Genital warts, genital herpes, and even hepatitis B. So if no say you follow for sexually transmitted disease, and I don't hear them today. Then you can't get parasites like pubic lice, scabies, trichomoniasis. All these ones they fit spread, and many of them they curable. Some of them, especially the bacterial one, like the organism, the germs where they cause them, they curable. Drugs they to treat them completely, like gonorrhea, syphilis, scabies, lice, and the rest of them. But some of them, unfortunately, no they curable. It's incurable, like viral disease, like HIV. But they get drugs to make sure the virus no can cause wahala. Or when person get herpes or genital warts, they get drugs to suppress the virus, but you know fit comot the virus pata for your body. Now you make we go dey careful. So what come be the complications? Why I can't dey worry now? Because of the impact they get on well-being. Just imagine say person get wound, herpes, in the pain. So the person no can't give normal life. Infertility. Many of these infections like chlamydia, gonorrhea can cause infertility. And some men they feel say I no follow na lie. 50% of couples male infertility they reach 50% now because now they feel say na only woman. But now men don't overtake. When una dey careful as they enjoy, when una sense dey inside. The next complication, as usual, now pregnancy complications. Yes, pregnancy complications. If a woman get HIV, if it give him pikin. If a woman get gonorrhea, in no treat am. If it spread and give him pikin too. Cancers, yes. Hepatitis B fit cause liver cancer if not they treated. Yes. And the genital warts, the organism, the germs who they cause genital wart fit cause cervical cancer, even cancer of the penis, and even stigmatization follow put for waiting be the complications. So how we can prevent them? Waiting the prevention of sexually transmitted infections. How we can shield body may we not can get sexually transmitted diseases. Number one, if you get one faithful partner, may you stick to them. Now good be that. Now treasure be that. Just chill body with the person. One, if you have one partner and discuss, come avoid multiple sexual partners. If maybe they share, you they collect, no, you go stop and you can't go for vaccine. Hepatitis B get vaccination, free of charge. You small money, check money. Human papillomavirus, one way they call genital warts, vaccination day for them. You can't they practice safe sex. I know some when I know chill, I no be pastor, I no be judge. But if I want you, no when I use condom. Yeah, some people say, I want skin to skin. They get ultra thin condom where you fit use enjoy yourself. Well, I don't hear about dental dam before. As they show for this video right now, that one, you get different colors, different flavors, where you go fit to use for those who engage in where they do oral sex. So it will still be pleasurable. You can't put them around the woman as they show for this video right now, or even around the mouth. For as is shown in this video, you get different colors, flavors, and the rest, and it still is sensitive, but it will protect you. For those who they use sexual toys, any kind of toy, from those with the 18 years, as a can show for this video. Oh, I know they share them. Don't be gift be that. You go use, can't give your friend, give, may you use. You know, so that they take the spread sexual transmitted disease and go wash and keep and clean. As you they take bath, and you go clean and keep them. Another thing what you go do, you go say you go cut hand, come hand small. For alcohol, when you drink excessively, your brain no go come dey. People where you go feed on normal day no go gel with, your body no go gree standard, you go come dey misbehave with them. You can't communicate when you have a faithful partner. Communicate or a new partner, talk about these things. You feel say my weight and test, may we know as we take day before we continue. Your decision. For those who never dey circumcised, they get at risk of spreading infection more to other people. And if they get, it no go show because they know they're circumcised, so it will be good. Then the last one where people not like this one, but the one we get 100% prevention, abstinence. abstinence never fails. No dey fail, no dey na 100%. As we don take reach this side, we go like this video, go comment put. I go give una assignment, make una write those infections wey I talk, write 4 wey you want me I talk for the next video. This one na part 1. Write any of the 4 infections you want me I discuss. The highest number na him I go discuss for the next